welcome back. This is Mommy Monday Tuesdays with Carly. Today I have a village doula on. Her first name is Ashli, and we're going to be going over some different topics today on birth stories, birth trauma, what inspired her to become a doula, and what it's like balancing work life full-time and being a mom full-time. Okay, how are you today?
I'm doing really well. Today. How are you?
Good. Are you at home or are you at your office?
I am at home in what will be my office, but right now it's just a room.
Hey, that's perfect. It looks really cute from the background. I'm like, oh, I see.
Yeah.
I love it. Makes me happy.
Yes. Oh, I can't wait to finish this room, but greenery definitely, whether it's fake or alive, as long as it's green.
As long as it gives that pop of color. Now, are your kiddos today or is it just you?
So I have one daughter. She's 2.
Or birth with your 2-year-old daughter? Is that your only one or do you have multiple?
Yeah, I only have the one daughter.
Okay.
I've only been pregnant once, and that birth, I definitely fall into the category of doulas or birth workers whose own birth stories kind of, started that fire.
Yep.
So my daughter's birth was definitely tricky. It was in the middle of the pandemic. Yeah, it definitely was difficult. It was, I was admitted from July 2nd at 1:50 in the morning, and I did not give birth until July 6th at 10:41 p.m.
Wow.
Via a cesarean that my husband and myself had to request.
Oh my God.
Yeah.
So you faced neglect in the birth space, which happens a lot. And I'm going to be parent to women of color most times the most. If you look at the statistics, it's really disappointing. It's really
Black women, even more statistically, it happens to Black women than white women, and even Spanish women. It's really sad, and it's actually gotten worse since the pandemic.
It's gone up 3 times or even 4 times, I think, since 2020, because I was looking into it and I was like, this is really, really disappointing and scary, because I think about my kids, in the future for our children, what is it going to be like for them? You know what I mean?
It's really brutal. And if we can't even show a glimmer of hope at the very beginning of life, which is birth, what are we doing?
Seriously.
Right.
It makes me so disappointed. I can't believe they let you labor for that long when you needed.
For that long. I actually spoke with a representative about it because I really felt like I was done an injustice. Yeah. And at that time, I didn't have the knowledge I have now, and I didn't have the voice that I have now. And with the pandemic and everything, I didn't have the village I would have had with me, had it not been during the pandemic. So my birth story, I'm actually writing a book. Yeah, I'm co-authoring a story about pregnancy during the pandemic. And it's actually a juxtaposition for women of color versus someone of another race who had a baby during the same time. So I'm really excited about that. And that'll be coming soon.
I'm excited. I can't wait to read it. Good. So when you had the cesarean, was your husband allowed in the room with you when they were doing the delivery?
It was so crazy. He was my fiance at the time. He was allowed into the operating room. And just for, I'm sure everyone listening, knows that we're in the birth work community, but just a little background, a cesarean happens in an operating room. So, that question is valid. Was he allowed into the operating room? Yes, he was. I went in first, and then they brought him in after, just with a little bit of time had passed, and it did not go according to plan. Not even the cesarean.
Really?
Yeah, but he was there
Good. That's good.
for part of it. A little spin.
Oh.
He was there for part of it. I was actually prolonged in my time on the operating table after my daughter had been born. So I was there for quite a bit of time by myself after the birth. My experience with the cesarean, I think, opened my eyes to just maybe how quickly or how easily someone could jump to the conclusion of a cesarean. And it's just not as simple as you would think, you know?
Yeah. It's a lot more difficult. And the recovery is so hard. When I had the recovery bit me in the ass. I had no idea that it was going to be so intense.
Right. No idea.
Yeah. And they don't really give you any preparation in the hospital.
Right.
And I don't know how your experience was with trying to breastfeed after having a cesarean, but everything is delayed. Well, it was with me.
Yes.
Yeah.
And it's funny because like you're one of the first people for me to, talk to about just that simple little piece of it. Yeah. I breastfed my daughter for 2 years and we did not have to supplement besides our time in the hospital.
Yep. And they do that and they put it on you and they're like, okay, well, you need to be at this birth weight. They need to be right back at birth weight before you can even leave. And you're like, my milk's not coming in because I've had so many different medications put into my body during this time. So it's hard. That's one of the hard. And lactation support is almost where I live over here. I live in New Hampshire, and our tiny hospital, like no lactation consultant, any support. No one was wanting to help me with breastfeeding. I had no idea what I was doing. And I'm sure you're probably in a similar boat with it being COVID.
Recognize the fact that support at that time is so, so, so important. And if we can't do it from the beginning, like, what are we doing? So yes, support in the hospital, education before giving birth, lactation consultants, pelvic therapists. There's so many aspects of this birth world. And I'm really only just starting off. I started my studies the January after my daughter was born. But my background is really in childcare.
It's great. You had to go through such a traumatic experience. Look where you are. Look what you're doing now. You're hiring other people and talking about it, which needs to happen. And it's just starting to happen more that people are talking, but it needs to happen more. So when you were in the hospital and the cesarean was done, how long did it take for you to get lactation support in your room? Did you get any at all?
No. I literally don't remember any lactation support. I remember them bringing me a pump and it just not like going very well. I had, what'd you say?
I said, oh yeah, no. And they don't even help you or even teach you how to use the pump. And most times we go in, we don't even know what we're doing.
And even like before that, latching or like that immediate skin to skin right after birth, like, if you have a cesarean, oftentimes that is already delayed and that can play a big role in it. So not having that support, not having that education, not having that time, that skin to skin right when we needed it, me and my husband were like left to fend for ourselves and figure it out. And they were going to make sure the baby was fed, but like breastfeeding, they're like,
Yep. They just pushed aside that initial emotional connection that you need.
Yeah.
That's so essential. And with my cesareans now, so it's not like it was during the pandemic. It's still really like no one's allowed in the room other than the partner in most cases. Now I tell everyone with their partner, or if it's even just me, we have to be the voice for people. And now their baby's right on the chest after cesareans, or they're having mom or dad or the support person, even if it's their mom or dad, do skin to skin with the baby so they have that connection immediately.
I am so happy to hear that, because literally only 3 years ago, it was very different, very different.
It makes me so disappointed still looking back, like the lack of care for so many people. And so many cesareans were happening too during the pandemic because there was just a heightened amount of stress and we're overlooked.
Right.
We're overlooked. And it's so disappointing. Now with cesareans, I do prepare a lot of clients, and I'm sure you will in the future too, just in case, because I like to cover, because you always want to be prepared no matter what, able to go into the birth space in case of an emergency or something changes and doesn't go how it's supposed to.
You can have your birth plan all mapped out, but the baby's really going to have the last say.
They are.
The baby and your body, right? So you can have your birth plan, you can have your affirmations, you can have it all ready, well and good, but you have to be prepared. Yep.
Change in the drop of a dime. So with that, what are your views on birth work, and where do you think you fall, like in your doula world? So when I say this, I'm coming from, I've been a doula for years. And now I'm falling more into the like radical birth worker realm. And I have a private association, so I can offer different levels of care with clients that midwives are neglecting people. Like they're teaching people how to be good patients in these hospital, like when you go in and they're like, oh, take these birthing classes with our hospital. It's really just teaching you how to be a good patient. It's not teaching the other side of things. And being a radical birth worker now, and I still offer doula services because there's a big difference. I just like to ask that question, like, where do you think you fall right now? And what are your goals for the future? Do you think you'll lean more to the radical side?
No, I definitely feel as though I'm leaning that way. And like, that's funny that, or I'm grateful that you actually put it into words for me, because I've been trying to figure out what I would call it. Right. So, you know, my background is in childcare. My family owns a facility. We've owned it for 25 years. We service ages 0 to 3. So I have always worked with families at this prime age, right? Pregnancy, about to give birth, or in the early childhood years. So I've been counseling for many, many years, a very long time. So really, I started my birth work after I had my daughter, and I started just virtually or in person with my clients. But this summer I'll be diving into like in-person postpartum and, you know, labor support. So I'm super excited about that. But certainly I am like on the radical justice birth side of it all. I don't see how I can't be. I feel like that would just literally be ignoring like the very problems that are in my face, you know, that I've been through. And I'm actually like working right now to try to develop, I'm like thinking of like birth centers. Like I've been looking at properties. I'm trying to figure it all out. So I'm really like a budding seed right now. But support, village, like that is my motto, a village doula. I really understand that it takes a village and that we all have to work together. And if that means that most of my birth work is just about communication, then that's what that means. You know, as long as I can do my part.
I love that so much. That's perfect. That makes me so happy too. And birthing centers are honest, like we need them. There's such a lack of states, and like the ones that are available most of the time are way overpriced, and the care inaccessible to most. And most families have multiple children. They're both working or one parent's working. So accessible care and a environment than a hospital. I love that. That's amazing. That is the dream.
There's a totally different way to do it, right? Like it doesn't have to be the way we've always been taught. And I'm really trying to look at how to create just a better experience from the start from the start of it all.
I'm really excited. I love that so much because we need it. Especially like when you're in labor too, you want to feel the most comfortable. It's going to help you more successful labor and delivery versus going in stress, heading into a hospital where the lights are extremely bright. All of these random people you don't know are around you. They don't care about your most cases. I mean, they're there for a 12-hour shift or more, and they're seeing dozens of people at a time. And I
didn't even know my doctor. Like the doctor that I had had a doctor. Then we switched because my doctor was in the city and the pandemic had hit and we just didn't think it was safe. So I had switched to a county hospital. I switched to a county hospital and and then my doctor had COVID. So like the doctor that I had, I barely know her name at this point. Like I didn't know who she was.
Awful. And so did she while you were in the hospital in labor?
I only met her when I was admitted. And she delivered my daughter. Yes, but like I only knew her those few days.
Wow. That's nuts. That blows my mind. Like it doesn't shock me though, because I only met my OB once. And the only reason I had an OB, so with my second, I had an OB for wives and obviously with an emergency cesarean, the OB. But with the second, I didn't even know who she was. Yeah. I was like, who are you? And I was like, why are you down at my vagina right now? I was like, I want my doula because we have to have our own doulas when we have babies because as much as we want to do it all ourselves, it's like.
No, I know. I've already started to think about that. Like, who would be on my team?
Yeah. You're like, who do I trust with my body, my husband, my baby, and my child? Because those are who you want at your birth. And you're going to be laboring most of the time if you're going to the hospital. If you're having a home, child is probably going to be present, which is beautiful. Those are huge. But I swear when we had our second last year, my OB was down and I was like, hi. And I was like, I labored at home the whole time. We live like 15 minutes away from the hospital. And thank God, because he was born 30 minutes after. Yeah, I know.
But good job. Good job.
I know, right? It was amazing. It was a miracle because I was told you can't do this by everyone except my doula.
Oh, me too. I've been told that I can't have a vaginal delivery. Yeah, I know.
Got this. I know you do. You're going to do so amazing with that, with your next one. What's it like balancing work life and being a mom? Because I think you own a property management business or you own properties.
So, I don't know what to call me. Birth worker, childcare provider, early childhood educator, entrepreneur, mompreneur. I don't know. You know what I mean?
Boss mom. Seriously.
It's definitely a learning process. It's a learning process. Don't give yourself some grace is what I would say. I'm fresh into it. I'm not fresh, but she'll be turning 3 this July. So just trying to balance it all and figure it out, but give yourself some grace. It's not easy. It's not easy.
Real. We'll beat up on ourselves and we're going to be like, oh my God, are we giving our children enough attention? And it's like, we are providing a life for our children and while still balancing. It's so hard.
The playroom is called For Our Littles because it's literally like they are the reason my baby is my reason. So no, I just try to make sure that the time that we do spend together, like I'm creating value, like I'm in tune with her during the times that we do have together. And, just like I'm scheduling things for my business, like make sure I'm scheduling fun time with me and just my baby, so that's all. Just be intentional.
Yeah. Carving out time. 100%. And they're at such a young age, which is great, but sometimes that can be heavy on us. Sometimes it's late at night, they're asleep and we're sitting there like, did we do enough with them? And we did do enough with them, even though we ourselves, because we're our worst critics in reality, like as moms and dads too. Like, we all are our worst critics, and we're too hard on ourselves sometimes, especially when we're balancing businesses and parenting.
I think I got a special point of view of it, growing up, owning a daycare, communicating with parents, like from the start, just watching my mom communicate with them and then taking on that role as I became an adult.
Yeah.
I definitely see that. And I try to put forth first support with my clients in our conversations. Because no, it's not easy. No one's perfect. Like, we don't have it all figured out, but we have each other.
Got the village. We do. Perfect. I loved when I saw a village doula pop up, and I was like, oh my God. I was like, this is my sign. I was like, thank you, universe. This is perfect. And I just love that. That was a perfect name as well, because so many people can relate, even the people that are, because you're their village, you and your family. Yeah. I'm here. Yeah. I'm right. Don't worry.
Yeah. Like, I will be right there. I will be your voice. We will figure it out. And, I am here.
That makes me so happy.
That was our interview with Ashli from A Village Doula. We touched on many different topics today, and we love talking to all of you. Have a great Monday and Tuesday.